You won't believe what I found in Margaret's medicine cabinet. 72 years old, former marathon runner, 3 prescriptions for her heart. And there, right next to her blood pressure pills, a bottle of something her daughter bought her from the health food store. Something 90 million Americans over 65 take every single day, believing it protects their hearts. I looked at her face. She had no idea. Within 6 months, her ejection fraction had dropped from 55% to 38%. Heart failure territory. The cardiologist blamed age. Her family blamed genetics. I blamed the bottle in her hand. And here's what makes me furious. Everything on that label was legal. Everything on that label was marketed as heart healthy. Everything on that label was quietly destroying the very organ it claimed to protect. If you're over 65 and taking supplements because someone told you they're good for your heart, stay with me. What I'm about to show you could be the difference between independence and a wheelchair. I've held beating hearts in my hands. 29 years as a cardiothoracic surgeon. Over 2,000 open heart surgeries. I've seen hearts the size of basketballs, hearts with holes, hearts that stopped and restarted on operating tables. But the cases that haunt me aren't the dramatic ones. They're the preventable ones. The patients who walked into my office with perfectly manageable conditions and walked out 6 months later needing a transplant because of something they bought without a prescription. The supplement industry in this country operates in a regulatory gray zone that would terrify you if you understood it. They don't need FDA approval before hitting shelves. They don't need to prove safety in aging hearts. They just need a label and a marketing budget. And the vitamin I'm talking about today has both in abundance. It's in your grocery store. It's in your pharmacy. It's probably in your home right now. And after 65, it changes from protector to predator. Your heart at 65 is not the same organ you had at 35. Think of it like a water pump that's been running nonstop for 6 decades. The chambers stretch, the valves stiffen. The electrical system that coordinates every beat develops microscopic scars. Your kidneys, which filter everything you swallow, operate at 60% of their youthful capacity. Your liver, which breaks down every vitamin and medication, processes compounds 30 to 40% slower. This isn't weakness. This isn't decline. This is biology. And here's the critical part. A substance that gets cleared from a 40-year-old body in 6 hours might circulate in a 70-year-old body for 18 hours. That's triple the exposure, triple the accumulation, triple the risk. One study from the Journal of the American College of Cardiology tracked 11,000 adults over age 65 for a decade. Those taking high-dose supplemental vitamins without documented deficiencies had a 27% higher rate of cardiac events than those who didn't. 27%. That's not a rounding error. That's a red flag written in medical records and death certificates. Here's what nobody tells you. The vitamin is E. And if you're over 65, it might be the most dangerous thing in your medicine cabinet. Let me show you why this matters and what it's actually doing inside your aging cardiovascular system right now. Vitamin E is marketed as an antioxidant, and technically, that's true. It neutralizes free radicals. It protects cell membranes. In a 40-year-old body with normal kidney function and normal clotting factors, it does exactly what the bottle promises. But after 65, the game changes. Your body doesn't clear vitamin E the way it used to. It accumulates in fat tissue. It builds up in your bloodstream. And when levels rise above the physiological range, vitamin E stops acting like a protector and starts acting like an anticoagulant. It interferes with vitamin K-dependent clotting factors. It thins your blood. Not in the controlled, monitored way that aspirin or warfarin does under a doctor's supervision. In a silent, untracked dose-stacking way that increases bleeding risk without anyone noticing until something goes wrong. I had a patient, Robert, 71, who took 400 international units of vitamin E daily because his wife read that it prevents Alzheimer's. He'd been on it for 8 years. Healthy guy. Walked 3 miles every morning. One day he tripped on a curb, small fall, bumped his head. Seemed fine. 48 hours later, he collapsed in his kitchen. Subdural hematoma, bleeding between his brain and skull. The neurologist asked me if he was on blood thinners. I said no. Then we checked his supplement list. Vitamin E. 8 years of daily accumulation. His clotting time was 30% longer than normal. A fall that should have given him a bruise gave him a brain bleed instead. Write that down. But the bleeding risk is just the beginning. Vitamin E also disrupts your heart's electrical system. Your heartbeat is controlled by ion channels, tiny gates in cell membranes that open and close in precise rhythms. Potassium flows out, sodium flows in, calcium triggers contractions. This happens in perfect coordination, 60 to 80 times per minute, every minute for your entire life. Vitamin E, when it accumulates, interferes with calcium channels. It disrupts the rhythm. And in older hearts, where the electrical system already has age-related wear. That disruption can trigger arrhythmias, atrial fibrillation, premature ventricular contractions. In rare cases, ventricular tachycardia. One analysis published in the Annals of Internal Medicine examined 19 randomized controlled trials. They found that high-dose vitamin E supplementation increased all-cause mortality. That means people taking it died at higher rates than people who didn't, from all causes combined, not just heart disease. The researchers suggested that doses above 400 international units per day should be avoided. But here's the problem. Most over-the-counter vitamin E supplements contain exactly 400 international units. Some contain 1,000. And nobody's checking to see if you're also getting vitamin E from your multivitamin, your fortified cereal, your protein shake, or your skin cream. It stacks, and your aging kidneys can't clear the excess fast enough. Have you checked how much vitamin E you're actually taking across all your supplements combined? Drop your answer in the comments. I read every single one. Now here's where it gets worse. Vitamin E competes with other fat-soluble vitamins for absorption. Specifically, it competes with vitamin K, and vitamin K is essential for proper blood clotting and bone health. When you flood your system with supplemental vitamin E, you create a relative vitamin K deficiency, even if you're eating leafy greens and getting adequate dietary K. This is why cardiologists see patients on vitamin E who develop unexplained bruising, nosebleeds, or bleeding gums. It's not just the anticoagulant effect of vitamin E itself. It's the secondary depletion of the vitamin that keeps your clotting system functional. I operated on a woman named Linda, 74, valve replacement, routine surgery. But during the procedure, she bled more than expected. Not catastrophic, but enough to extend her surgery by 90 minutes and require 2 units of transfused blood. Afterward, I reviewed everything. Her clotting factors were borderline low. Her vitamin K levels were suppressed. She wasn't on warfarin. She wasn't on aspirin. But she'd been taking 800 international units of vitamin E daily for 12 years because a magazine article said it prevents wrinkles. The irony? Vitamin E doesn't prevent wrinkles when taken orally. It might help when applied topically to skin, but swallowing it doesn't deliver it to your face. It delivers it to your bloodstream, where it disrupts systems that were working fine without it. Here's what nobody tells you. Your body is not deficient in vitamin E unless you have a diagnosed malabsorption disorder or severe malnutrition. The average American diet provides 8 to 12 milligrams of alpha-tocopherol daily from nuts, seeds, and vegetable oils. That's sufficient. Supplements deliver 15 to 100 times that amount. Your heart doesn't need 15 times the normal dose. It needs exactly what evolution designed it to run on. And yet the marketing continues. Antioxidants, heart health, cellular protection. All technically true statements that omit the most important word, dose. Aspirin prevents heart attacks. But if you take 15 aspirin a day, you'll bleed to death. Water is essential for life. But if you drink 6 gallons in 2 hours, you'll die from hyponatremia. Dose determines whether a substance is a medicine or a poison. And for vitamin E after age 65, the dose that the supplement industry sells is far beyond what your aging cardiovascular system can safely handle. Stay with me, because the next item on this list is something your doctor probably told you to take. And it's even worse. The second substance is calcium supplements without magnesium. You've been told your whole life that calcium builds strong bones, and it does when you're young, when your hormones are balanced, when your kidneys regulate mineral absorption properly. But after 65, unsupervised calcium supplementation doesn't go to your bones. It goes to your arteries. Let me explain how this happens. Your body maintains blood calcium levels within an incredibly narrow range. If calcium drops, your parathyroid glands release a hormone that pulls calcium from your bones into your bloodstream. If calcium rises, your body is supposed to store the excess back in bones or excrete it through urine. But this system depends on adequate vitamin D, adequate magnesium, and healthy kidney function. After 65, most people are deficient in vitamin D. Most are deficient in magnesium. And kidney function declines by about 1% per year after age 40. So when you take a 1,200 milligram calcium supplement, your body can't process it the way it used to. The excess calcium circulates, and it deposits, not in your bones, in your blood vessels. This process is called vascular calcification. It's exactly what it sounds like. Calcium crystals form inside the walls of your arteries, turning flexible vessels into rigid tubes. Your heart has to pump harder to push blood through stiffened arteries. Blood pressure rises, plaque builds up around the calcium deposits, and your risk of heart attack and stroke skyrockets. A study from the Journal of the American Heart Association followed more than 2,000 adults for 10 years. Those taking calcium supplements had a 22% higher risk of coronary artery calcification compared to those getting calcium from food alone, 22%. And the effect was strongest in people over 65. I had a patient, Donald, 68, who came in for a routine cardiac CT. We found calcification scores in the 95th percentile. His arteries looked like tree branches covered in ice. He'd never smoked. His cholesterol was normal. His blood pressure was controlled, but he'd been taking 1,500 milligrams of calcium daily for 15 years because his doctor told him it would prevent osteoporosis. It didn't. His bone density was still low, but his coronary arteries were full of calcium. That calcium didn't come from his diet. It came from a bottle. And it ended up in the last place he needed it. The third item is high-dose B vitamins, particularly B6 and B12, taken without medical supervision. You've probably heard that B vitamins boost energy, support nerve function, prevent cognitive decline. All true in deficiency states, all dangerous in excess. Here's why. Vitamin B6 in high doses, anything over 100 milligrams daily, can cause peripheral neuropathy. That's nerve damage in your hands and feet, tingling, numbness, loss of coordination, and it's often irreversible. Your nerves don't regenerate the way your skin does. Once the damage is done, it's permanent. I've seen patients who took B6 for years because a supplement store clerk told them it helps with arthritis pain. It doesn't, but it does destroy the nerves that send pain signals, which creates the illusion of relief until you realize you can't feel your feet anymore and you're falling because your balance is gone. Vitamin B12 is a different problem. In high doses, particularly in synthetic cyanocobalamin form, it can trigger acne-like skin eruptions and, more seriously, mask underlying B12 metabolism disorders. Some people have a genetic variant that makes it difficult to convert synthetic B12 into the active methylcobalamin form your cells actually use. When you flood the system with cyanocobalamin supplements, lab tests show high B12 levels, so doctors assume you're fine. But your cells are starving for the active form. You develop fatigue, cognitive fog, and neuropathy despite high serum B12. The supplement created a false negative. It hid the real problem. And here's the kicker. B vitamins are water-soluble, so the supplement industry markets them as safe because excess just gets peed out. That's true for young kidneys processing normal doses. It's not true for 70-year-old kidneys processing megadoses. Your kidneys at 70 filter about 60 milliliters per minute. At 30, they filtered 120. That's half the clearance rate, so a dose that gets cleared in 4 hours at age 30 takes 8 hours at age 70. Double the exposure, double the accumulation, double the toxicity risk. Have you ever had numbness or tingling in your hands or feet that your doctor couldn't explain? Comment below. This might be why. The fourth item is iron supplements taken without a documented deficiency. Iron is essential. You need it to make hemoglobin. But unless you're bleeding, menstruating, or diagnosed with iron deficiency anemia by a blood test, you don't need supplemental iron. And if you're over 65, taking it anyway is dangerous. Here's what happens. Iron is a pro-oxidant. It generates free radicals. In the presence of oxygen, which is everywhere in your bloodstream, iron catalyzes reactions that damage cell membranes, DNA, and proteins. Your body knows this, which is why it stores excess iron in a protein called ferritin and keeps free iron levels tightly controlled. But when you take iron supplements without needing them, you overwhelm that system. Free iron circulates. It oxidizes LDL cholesterol, turning it into the form that embeds in artery walls and starts plaque formation. It damages the endothelial cells lining your blood vessels, making them sticky and prone to clotting. And it accelerates the progression of atherosclerosis. Multiple studies have linked elevated ferritin levels, a marker of excess iron, to increased cardiovascular risk. One Finnish study found that men with ferritin levels in the top third of the normal range had 3 times the heart attack risk of men in the bottom third. 3 times. And we're not talking about iron overload disease. We're talking about people taking a daily multivitamin with 18 milligrams of iron they didn't need. I had a patient, 73-year-old man, who took iron because he felt tired. No blood test, just tired. He assumed he needed iron because that's what the commercials say. 8 months later, his ferritin was over 400. His liver enzymes were elevated. His fasting glucose was creeping into pre-diabetic range. Iron promotes insulin resistance. It increases diabetes risk. And diabetes is a massive cardiovascular risk multiplier. We stopped the iron. Within 6 months, his ferritin dropped to 180. His energy improved. His glucose normalized. The fatigue he thought was from low iron was actually from too much iron poisoning his metabolism. Starting tonight, if you're taking iron and you haven't had a recent CBC and ferritin level checked, stop. Get tested first. Let the numbers tell you what you need. Don't guess. The fifth item is fish oil in doses over 1,000 milligrams of combined EPA and DHA per day. I know this one will surprise you. Fish oil has been marketed as a miracle supplement for decades. Omega-3s, heart health, anti-inflammatory, brain support. And yes, omega-3 fatty acids are beneficial when you get them from eating fish twice a week, not when you get them from swallowing 4 grams of concentrated oil in a capsule every day. Here's the problem. Fish oil is a blood thinner, not as strong as warfarin or aspirin, but strong enough to matter. In high doses, it inhibits platelet aggregation. It prolongs bleeding time. And if you're over 65 and already on aspirin, or if you're on any anticoagulant, stacking fish oil on top increases your bleeding risk dramatically. The VITAL study, published in the New England Journal of Medicine, tracked over 25,000 adults taking omega-3 supplements. No reduction in major cardiovascular events, no reduction in cancer, no reduction in death, but a statistically significant increase in atrial fibrillation in the supplemented group. Atrial fibrillation, the most common arrhythmia, the one that quintuples your stroke risk. High-dose fish oil triggered it. I operated on a man who had a mitral valve repair. Routine surgery, but he bled into his chest cavity post-op. We had to take him back to the OR to find the source. It wasn't a surgical error. It was fish oil. He'd been taking 4 grams daily for years. Nobody told him to stop before surgery. His platelets didn't work. He bled, and he spent an extra week in the ICU because of a supplement he thought was protecting him. If you're taking fish oil, ask yourself, do I eat fish twice a week? If yes, you don't need the supplement. If no, eat the fish. Your heart doesn't need 4 grams of extracted oil. It needs the whole food with the protein, the selenium, the vitamin D, and the matrix of nutrients that actually deliver the benefit. Write that down. I'm standing in an operating room. The patient is open on the table. The family is in the waiting room, praying, pacing, checking their phones every 30 seconds. And I'm holding a heart that shouldn't be this damaged. This patient is 70, non-smoker, healthy weight, walks every day, no diabetes. But the left ventricle is dilated. The ejection fraction is 30%. The mitral valve is leaking. And when I ask the family what medications and supplements they were taking, I get a list. Multivitamin, vitamin E, calcium, fish oil, B-complex, iron, CoQ10, all bought without a prescription. All taken because someone said they were good for the heart. None of them prescribed by a doctor who knew this patient's kidney function, liver function, medication interactions, or age-related vulnerabilities. That question has stayed with me. How many families sit in waiting rooms because they believe the label on a bottle more than they believe the biology of aging? How many hearts fail, not because of disease, but because of what we're sold in the name of health? Margaret, the patient I mentioned at the beginning, stopped the vitamin E. We optimized her real medications. We got her on a proper evidence-based heart failure regimen, ACE inhibitor, beta blocker, aldosterone antagonist. Within 4 months, her ejection fraction improved from 38 to 47%. Not perfect, but functional. She went from needing help getting dressed to walking her dog again. And the last time I saw her, she said something I'll never forget. I wish someone had told me this 5 years ago. My daughter thought she was helping. The bottle said heart health. How was I supposed to know? She wasn't. That's the point. The industry doesn't want you to know. It is never too late to ask the right questions. Here's what matters. 5 items. Write them down. 1. Vitamin E, over 400 IU daily after 65 increases bleeding risk and disrupts heart rhythm. Stop it unless you have a diagnosed deficiency confirmed by blood test. 2. Calcium supplements without magnesium and vitamin D go to your arteries, not your bones. Get calcium from food. If you need a supplement, take it with magnesium and get your vitamin D level checked. 3. High-dose B vitamins cause nerve damage and hide real deficiencies. Take them only if a blood test shows you need them. 4. Iron without a documented deficiency accelerates artery disease and raises diabetes risk. Get a CBC and ferritin test before taking any iron. 5. Fish oil over 1 gram daily increases bleeding and arrhythmia risk. Eat fish twice a week instead. That's the list. Now I want to hear from you. Which one of these 5 surprised you the most? Have you been taking any of them for years without knowing the risks? Comment below and tell me. Your story might save someone else. And if this information helped you, share this video with someone you love who's over 65 and taking supplements. They need to hear this. If you want more evidence-based heart health information that cuts through the marketing and tells you what actually works after 60, subscribe to this channel. I post new videos every week. Your heart has been working for you every single minute of every single day since before you were born. It deserves information, not advertising. I'm a cardiothoracic surgeon, not a cardiologist, and I'm definitely not your cardiologist. Everything I've shared here is based on published research and 29 years of surgical experience, but it's educational, not medical advice. Before stopping or starting any supplement or medication, talk to your doctor. Show them this video if it helps. Get your labs checked. Make decisions based on your specific health status, not on what worked for someone else. This is about empowering you with information, not replacing the doctor who knows your chart.